chemotherapy has a role for glioblastoma multiforme. It is usually, if you see, I'm sure you talk to your oncologist and they say this is a high-grade cancer. High-grade, that means it's just more aggressive and it does need treatment after surgery.
But this is a very delicate area. We're talking about the brain. So
that's right.
What are the chances, like if somebody had a surgery in that area, that they'll come out alive, or maybe the cancer is cured?
That's a very good question. In the brain, that's actually a very smart question. Yes. So the brain, if you think about the brain, each area in the brain has a specific function. One area deal with movement, another area deals with talking, another area deal with the vision. So it really depends on where the cancer, where the tumor in the brain.
I see.
If someone had a tumor in the, I'm a right-handed. If I have a tumor in the left side on my brain, that means probably I'll end up not able to talk, lose the ability to talk, and left side, then I lose the power in the right side. If that tumor is in the area which is responsible for the movement. But if someone had the tumor in the front, this area, actually the front of the brain, we don't know much about it, but we know some, but at least does not deal with the movement. That person is still able to function, able to talk, able to use his or her arms and hands. So really the location where the tumor, and that is very important. Yes. So it depends on the location.
The issue of sometimes people have surgeries, or they are treated for cancer, but it does come back. So how would I know that I'm really cured completely? So is there any monitoring process for cancer?
It depends on what kind of cancer. So if we go back and say, let's just take breast cancer as an example. If a woman had a breast cancer and that is removed, usually the breast cancer generally does follow the rules. It goes from the breast to the lymph node under the arms, and the lymph node really, the function of the lymph node is like a guard at the door. No one entered the room without checking with the guard. That's the lymph node. It really drains the fluid, the body fluid from the breast. If there is cancer, that cancer has to check with the guard, which is the lymph node, before it is spread. So if we have someone with the breast cancer, say that is went to the lymph node. So after removing the cancer, remove the lymph node, and nowadays we do have really good tests, CAT scan and MRI, and there's something called PET scan, PET. That scan can detect cancer anywhere in the body. Say, give an example, a woman had cancer that was removed from the breast, removed from the lymph node, and we do all the scan, we don't see anything. That's good. Is it a cure? No. But we don't see cancer that is, we don't see cancer in the body. So we say that patient does not have any evidence of disease. So how we monitor? After we treat, we monitor 3 ways. Number 1, physical exam. Check for lymph node, no mass, no tumor. Then we monitor with the scans. CAT scan, we look at the lungs, at the liver. Bone scan, we look at the bones. PET scan, we look at the whole body. MRI, we look at the brain. Nothing. Anything. So we tell the patient, you're doing fine. How we monitor? There is also blood test. We call it cancer marker. For breast cancer, there is a test called CA2729. That's the name of the test. That is, we can check, once a year, every 6 months, usually once a year. And if that test, which is the material in the blood produced by the cancer cell, if it goes up, we think there is a cancer. It doesn't mean there is a cancer, but at least it gives us a hint or a clue that is cancer is coming back. And then we go and check with the scans to find out. But yes, we can monitor cancer with scans and with blood tests.
Talking about cancer in America versus cancer in Japan, I want to talk about lifestyle.
Yes.
Where are we at in comparison to other countries?
For example, when we say there is some cancer that has a cause. Talk about lung cancer, and then in Far East, there is some type of cancer we don't see here that much. For example, in Japan, in the Far East, in China, we do see more cancer of the esophagus. We do see more cancer of the stomach. We do see more cancer of the liver. Liver, interestingly, is caused by a virus, hepatitis C, which is can be transmitted in the blood, and then the patient develops something called hepatitis C infection, and then that may lead to hepatocellular carcinoma in like a period of.
So that leads to a question, because you did mention something about I think Southeast Asia. You meant the type of food they eat and the spices. You see that in India, Pakistan, Bangladesh. Is there any effects, any relationship, any study being done?
I really don't. I don't know if there is a relation, any relation to food. But for example, in the third country, there is a peptic ulcer disease caused by a bacteria called H. pylori. H. pylori is the bacteria that is, it causes peptic ulcer disease. People with heartburn and indigestion, and that bacteria can cause stomach cancer.
And that's because of the food they eat?
I don't think it's the food.
What's the cause?
It is a bacteria. They get the bacteria, and it is common there. More than 70% of the people who have stomach ulcer disease, it is due to the bacteria in the third world, and they develop some kind of a lymphoma of the stomach. Interestingly, this cancer can be treated with antibiotics. Believe it or not. Yes, because you just treat the bacteria, get rid of the cancer.
Root cause. We are with Dr. Elshami Elamin, and do have Roy. Good evening, sir.
Good evening.
Hi.
Hello there. How are you?
Pretty good.
First, you mentioned a small case about hepatitis C. I visited the state of California, and the news broadcast news were talking about